Dear viewers, today I am going to discuss on a very important topic, that is Pyometra in beach. Actually, Pyometra is a very deep concern to the pet owners, and the pet owners are very much worried about this problem. Now, what is Pyometra? Pyometra actually it indicates that there is accumulation of pus in the uterus. When there is accumulation of pus in the uterus, this condition is ascribed as Pyometra. Which suffering this problem manifest certain signs which are anorexia, that means loss of appetite, frequent urination we call polyuria, and excessive thirst we call polydipsia, sometimes vomition, and if you look at the vulva, you will find that there is discharges from the vulva. Actually, if you take the statistics, you will find that mostly older multiparous beach frequently suffer from Pyometra complex. Actually, why this happens? It is a problem lies with two attributes. One is unhygienic conditions. That means hygiene is one of the important aspect, and second aspect is the hormonal aspect. Actually, progesterone hormone influence the development of it. Prolonged progesterone hormone therapy or prolonged progesterone secretion actually creates the suitable environment for the development of Pyometra in beach. And progesterone is to cause increased secretion of endometrial gland and thus accumulation of fluid within the uterus. When there is accumulation of fluid within the uterus, this paves the way for the microbial population to get upper hand and produce inflammatory changes in the endometrium. Of all the microbial population, E. coli is the most important organism for this disease. Now, if you consider Pyometra, the owner is to say that my dog is suffering from Pyometra, what will be the ultimate fate of the animal? The fate remains with the intensity of the infection. At the same time, whether it is a closed Pyometra or it is a open Pyometra, right? But we can take into consideration Pyometra into 4 types, and there is number 1 is cystic endometrial hyperplasia. Second is CEH with neutrophil and plasma cell infiltration. Third is endometritis with lymphocytic infiltration. And fourth is endometriosis with systemic illness. Let us consider one by one. Cystic endometrial hyperplasia. Here there is thickening of endometrial lining, and which there is high secretion of estrogen followed by elevation of progesterone. This promote CH, and CH means cystic endometrial hyperplasia, may invite infection. If you go for the second step, in the second step, infection occurs through organisms which are normal inhabitant of genitalia. E. coli is the primary organism. Infection is more in intact bitch rather than pregnant one. Here the question lies, if the animal is once pregnant, chance of pyometra is less. This is the conventional thought. And so, if the animal is intact, in that case, chance is more. Right? The pregnancy may have some protective or preventive effect at endometrial lining. Though E. coli is the predominant organisms, but other organisms including Streptococcus, Staphylococcus, Klebsiella, Proteus, Pseudomonas species and Corynebacterium may also invade the uterus. It is pointed out that insulin-like growth factor 1 located in and around epithelial cells of endometrium in dog may help in the development of pyometra. The thing is this, the toxins liberated in the uterus may cause renal insufficiency, right, due to the endotoxins of the organisms. So, in a pyometra case, one should have to take care of the kidney function, whether the kidney is alright or not. Now, if you consider the pyometra and if you go for the clinical observation of it, we can say subclinical pyometra. Subclinical pyometra is often observed in the middle-aged pitch, and the manifestations are malaise, depression, weakness, mucoid discharge, and slightly thickened palpable uterus. And typical pyometra is characterized by anorexia, means loss of appetite. There is depression, there is lethargy, abdominal distensions, polydipsia, polyuria, pale conjunctival mucous membrane, subnormal or high temperature. If there is closed pyometra, there is no discharge. If it is open pyometra, there is cream-like or sanguineous or serosanguineous brown discharge. Often the animal will leak the vulvar region. And if you go for the atypical pyometra, there is no appreciable clinical signs, shows weakness or paresis of lumbar region or hind limb, pain of muscles of the hind quarter. This may be due to toxic arthritis. Bleeding from vagina is the striking sign in case of atypical pyometra. Now, if you want to detect the pyometra, what should be your line of action? First of all, you have to take the history and clinical signs. History often you have to get from the owner. Owner will say, there is some discharge from my bitch. And if clinical signs already I have described about the clinical signs, that has to be taken into consideration, diagnosis. We can go for CBC, and CBC will get anemia, low PCB, and marked leukocytosis. And if you go for the blood biochemistry, you will find elevation of BUN and creatinine. This is very important. When we get a case of pyometra, we must see the kidney status. That means BUN and creatinine level is very, very important for the standpoint of the veterinarian. Vaginal examination, presence of discharge. You can make radiography, you will get evidence of pus-filled uterus. You can make USG, tortuous convolution appears as an anechoic circular structure because of ECUSG. And sometimes blood and endotoxin level, if you have the laboratory like that, you can get the blood endotoxin level. High N 9.5 picogram per ml is a high. Now, how do you manage Pyometra? These are very important things. Now, question arises whether I should go for medicinal treatment or I shall go for surgery. This is a very important aspect of it. Now, since it is a infection, and therefore one may try to combat the infection if it is mild in nature with some systemic antibiotic. It is better to go for drug sensitivity test. In vitro drug sensitivity test will be better. Again I tell you, since pus is there, if you give local treatment, say local treatment may not do, because it will not, pus will act as a barrier of penetrations of bacteria, antibacterial agents, and therefore it is better to go for injection, and it is preferred if you go for intravenous injection. Since there is toxemia, so we have to go for large volume of fluid to be given to prevent uremia and toxemia. So fluid therapy is must. And you can flush the uterus, try to flush the uterus with antibiotic. And if you want to expel the pus, you can take the help of oxytocin preparation in case of open pyometra. Oxytocin or cetirizine may be given so that it may clear up the pyometra. Natural prostaglandin, Butyrols may be used, or estrogen progesterone preparations in some cases to prevent anorexia, dextrose, mannitol, laxatives, etc. Depending on the conditions one may use. Finally, when medical therapy fails, in that cases, rational treatment is to go for your ovary hysterectomy. Ovary hysterectomy is the answer. And after ovary hysterectomy, one has to follow up with antibiotics and other preparations as is required or heal. Now I am telling you that what I want to suggest some points. First of all, the owner generally asks us whether mating is necessary to prevent pyometra or not. It's a very pertinent question. So answer is that if you can maintain your dog during your period or cycle with proper hygienic conditions, in that cases, chance of pyometra will be very, very less. But if you give a chance for pregnancy, so in pregnancy, once pregnancy, that also creates an environment which does not allow the infection to flare up, and in that cases you can avoid pyometra. Therefore, the question is that whether I will go for mating or not. So suggestion is that if you can maintain with hygiene, better hygiene, in that cases mating may not be necessary. But if you cannot do that, in that cases one mating is important in relation to development or genesis of pyometra. This is number one. Number two, whether pyometra is preventable. Now, one thing that I tell you, even after ovary hysterectomy, and therefore in that cases there is a stump, and we call it stump pyometra. And this stump and pyometra continue to exist in spite of your surgical operation. So you should take into mind that surgery is not only the answer of prevention of pyometra, because stump pyometra may continue to exist even after the successful completion of the surgery. So this is about your pyometra in beach. So my point is that number one, hygienic measures has to be taken preferably when the animal is under heat or when the animal is under cycle. In that time, the hygienic measures has to be taken into consideration, especially discharges are to be cleaned, the antiseptic, and animals should not be allowed to roam here and there, right? Confinement is very important. And second thing is that the partner, if you go for mating, the partner's health also is very important. If the partner is infected, so it may infuse infection in which, and therefore which may suffer from your pyometra problem. So these two aspects has to be taken into consideration while you go for pyometra in beach. Thank you.
যদি আপনাদের আমাদের এই চ্যানেলটি ভালো লাগে তাহলে সাবস্ক্রাইব করুন এবং শেয়ার করুন।